You're listening to Morning Edition on this Wednesday here on WCBU. I'm Rich Strager. A new partnership among 6 institutions is focused on meeting a growing demand for medical professionals in central Illinois. Greater Peoria Healthcare Education Consortium officially launched last week after 4 years in development. It brings together Peoria Public Schools, Illinois Central College, Bradley University, and the University of Illinois College of Medicine in Peoria in cooperation with Carle Health and OSF Healthcare to establish a pathway into medical careers. Peoria City Council member and UICOMP professor Kiran Velpula is a driving force behind the initiative, which also has support from the Greater Peoria Economic Development Council. Velpula tells WCBU reporter Joe Deacon why the consortium is needed and how it will boost regional growth and development.
The idea is majority of the kids decide whether they wanted to do medicine, or they wanted to do engineering, or whatever career path. They decide early in the middle school, by 7th grade or 8th grade. If we kind of tap into them and kind of help guide them through the process and see whether they could actually be in a curriculum where they can be in a pipeline where they can have ICC as the second goal, then go to Bradley, then the ultimate goal would be going to the med school. For us, I have 2 goals. 1, to build the workforce development. 2, to kind of empower Peoria for a financial growth.
And how long has it taken to kind of develop this consortium and program?
The first meeting that happened, May 16th of 2022. And the first meeting has, I would say, 4 or 5 heads of the institutions. Then we realized that it would be incomplete if we don't rope in the healthcare institutions, because the educational institutions produce the talent. But that talent should be retained, meaning you have to have one end of the employers to be there with you.
How has the need for healthcare workforce development reached this point in pursuing a consortium of this nature?
People think that there are no jobs, or people think that there is talent but there are no jobs. I have to rephrase it. What it would be is, there is a need for healthcare workers in the town because we are a healthcare city. OSF employs close to 23,000 people today. And because of the new cancer center, because of the newest medical facilities that are coming to Peoria, we need more and more health force.
How would you describe the importance of this consortium then to the regional medical community and the community as a whole?
Every parent or every student wants to go out and study. They just don't want to stay back in the community. But there are people who want to stay back in the community. What we wanted to do, or the consortium want to do, is give that opportunity to the students or the families to say, if you go to this career, you have an opportunity right here in Peoria. You don't need to go anywhere.
What do you see as the biggest challenges in attracting young people to healthcare professions?
I think we don't need to attract. The interest is always there. Our interest is to make sure that they stay back in Peoria.
Are there specific fields within the medical workforce pipeline that are facing a greater need than others?
I think the need is cumulative. The need keeps on growing because as we expand our medical facilities, we need more people. And we need more people at different levels in the hospital system, in the healthcare system. One challenge is we need to advocate more. What kind of opportunities do you have? That would be extremely helpful for the students to kind of take this as a career path.
What are some of the programs that have already started through the consortium?
As of now, we are still trying to kind of tweak the administration part of it. Now we have the boots on ground with the Greater Peoria Economic Development Council coming on board. So it will be extremely helpful for us because they have the muscle. They can actually go to the community, then say, this is the program. Every educational institution has their own agenda. They have to do their own stuff. But now, since we created a baby, this baby will be nursed and grown by GEPDC.
That was Kiran Velpula discussing healthcare workforce development with Joe Deacon for WCBU Reports. Find more from this conversation at WCBU.org. You're listening to Morning Edition here on WCBU.